Hey youth, welcome to Nursing Lecture Dose. Today we are dealing with new topic dysmenorrhea. It is come under the heading menstrual disorders. So moving to the topic. What do you mean by dysmenorrhea? Okay, we can split the dysmenorrhea into dys, men, and oria. So dys means what? Difficulty or pain, and men means month or menstruation, and oria means flow or discharge. Means we can split dysmenorrhea into dys, men, and oria. For this, we can simply remember what you mean by dysmenorrhea. Dys means difficult or painful or abnormal. Then men means month or menstruation, and oria means flow or discharge. So, summing up, we can make the definition that dysmenorrhea means difficulty or painful menstruation. So, menstruation is usually come with flow and discharge. We define dysmenorrhea as painful menstruation. Moving to the original definition or the definition we can write in the exam, that is painful menstruation of sufficient magnitude as to incapacitate day-to-day activities. That means the patient had severe painful menstruation at sufficient magnitude so that the patient cannot do their daily activities such as going to work or performing day-to-day activities such as. Moving to the classification of dysmenorrhea, the mainly it is classified into primary and secondary. So what do you mean by primary dysmenorrhea and what do you mean by secondary dysmenorrhea? Primary dysmenorrhea means there is no identifiable pelvic pathology. That means there is no reason why this pain occurs. There is we cannot identify due to what reason this dysmenorrhea occurs. In secondary dysmenorrhea, it means there is an identifiable pelvic pathology. Identifiable pelvic pathology. So that is the classification of dysmenorrhea, primary and secondary. Moving to the causes of dysmenorrhea, primary dysmenorrhea, that are psychosomatic causes, abnormal anatomical causes, and imbalance in the autonomic nervous control of uterine muscles. So, what do you mean by psychosomatic causes? The psychosomatic causes are tension, anxiety during the adolescence, then abnormal anatomical and functional aspect of myometrium, that you mean by uterine myometrial hyperactivity, and last one is the imbalance in the autonomic nervous control of uterine muscles. Moving to the etiopathogenesis. What do you mean by etiopathogenesis? Etio means what? Cause. And pathogenesis means what? Development. So moving to the etiopathogenesis. Due to the dysmenorrhea, what are the cause of or what are the development of how the dysmenorrhea develops? So moving to the etiopathogenesis, during menstruation, progesterone will be high. During that progesterone lead to prostaglandin F factor 2 alpha increases. These lead to endothelial leukotrienes and platelet activating factor and leads to what? A reduced blood flow. Due to these endothelial and platelet activating factors and leukotriene, it's due to what? Increase in the myometrial contraction. It leads to increase the myometrial contractions and a reduce in the blood flow that lead to myometrial angina. That means what? Due to the decrease in the blood flow, O2 supply also decreased. That lead to what? Pain. It what lead to dysmenorrhea. Clinical features of dysmenorrhea. In the beginning itself, I mentioned that dysmenorrhea means what? Painful menstruation. So the important and very prominent clinical features is pain. The pain is usually begins a few hours before the menstruation or after the onset of menstruation. It lasts a few hours or up to 24 hours and it may persist up to what? 48 hours. So the pain, the dysmenorrhea pain, primary dysmenorrhea pain, usually spasmodic and confined to lower abdomen only, and it may radiate. It also what? The pain may radiate. The pain may radiate to what? Back and thighs. So that the clinical features of the pain begins a few hours before or just the onset of menstruation. It may the severity of pain may last for few hours or may extend up to 48 hours. The pain is confined to our lower abdomen and it is radiating to the back and thighs. Other clinical features are nausea, vomiting, fatigue, and headache. So these are the clinical features of dysmenorrhea, primary dysmenorrhea.